Thank you, Dr. Joshi. I'm going to ask Dr. Anwar now to give us some remarks discussing rural coverage, please.
Good morning, ladies and gentlemen. My name is Dr. Anwar, and I'm an internist and a respirologist. I'm presently working at Health Sciences. But when I initially moved into the province in 2006, I worked for almost 2 years at Carbonear Hospital. Even after when I moved to town, I had strong ties with the rural medicine, and I have provided coverage, which is the locum coverage, at different hospitals when they did not have any coverage. I have worked in many different rural hospitals and hospitals in Gander, Clarenville, Buren, as well as in Carbonear. So I have a fairly in-depth knowledge of the different challenges and the problems that are not only the population in that area, but also the physicians face in practicing rural medicine. The biggest problem, obviously, is the severe shortage of manpower. The most importantly, obviously, is the physician, but it is not just limited to the physicians. The manpower shortage exists in all the ancillary services as well. There's shortage of nurses, there's shortage of respiratory therapists, there's shortages of all the support staff that is out there. And that basically prevents the timely and effective delivery of healthcare to these populations. This lack of manpower is because it is very difficult to recruit physicians and the ancillary support staff in these areas, as well as difficult to retain the physicians in that area. And there are multiple reasons for that. The patients also have to face a lot of difficulty in obtaining timely and effective healthcare in these situations. The population, if you look at the population demographics, we are dealing with mostly with aging population with multiple comorbidities, multiple medical problems that require very close intervention. They need frequent acute care that can only be provided by internal medicine specialists. Internal medicine specialists essentially forms the backbone of any rural hospital. They provide support to the emergency room. They cover patients who are in the intensive care unit. They do outpatient clinics. They do endoscopies. They do stress testing, Holter monitoring. So essentially, they provide all the major services that the rural hospitals provide. So they are the most essential element. But if you look at the deficiencies, there's almost 60% deficiency of physicians in any given hospitals all over the province. Because of that, the patients have to wait for a much longer time to get to see an internist, and that delays coverage. Even if they get into the hospital, sometimes they have to see a physician who's only providing part-time coverage. There is no continuity of care. When they are discharged from the hospital, they have to return to their family physicians. Because of these comorbidities, these patients are better served if they are looked after by an internist, which is not always possible in rural Newfoundland. And that compounds to the problems that these patients face. That also makes the life of the family physicians there much difficult because that increases their workload, plus they have to take care of these very sick patients that they're not trained and geared to handle. So that increases their frustration and their problems also. As far as the internal medicine specialists are concerned, because of this shortage, they are overworked, they are stressed out, they have to provide extensive call coverages, which is way beyond what they are capable of doing, and they are stretched thin at this point in time. Because of that, most of the physicians have a very short stay in rural Newfoundland, and they tend to leave. Recruitment is just one problem. Retention is another big problem. And if you look at the average lifespan of a physician in rural Newfoundland, it is fairly short. And that is because of this lack of support staff, the lack of coverage that is present, and the extensive workload that they have to do. Especially now with the situation getting worse and more job opportunities, and we talked about the provisional license in other provinces opening up the provisional licensing, this problem is going to get compounded as the years go by. Something must be done immediately to overcome this lack of manpower. status quo is not an option. The government must have to join forces with the physician to provide a feasible and a viable solution to overcome this shortage of physicians as well as the ancillary staff that is present in rural Newfoundland. Thank you.
Thank you very much, Dr. Anwar.